As we age, our minds and our bodies inevitably change, often not for the better. However, it's part of the normal aging process.
Fortunately, there are steps you can take to stay healthy and active as you age.
Our guest on today's Health Talk is an expert on this subject, and he will provide some important tips that we can all use right now to promote healthy aging.
So stay tuned, we're coming up next.
Hi, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. We have an interesting show for you today. Our guest is Dr. Joseph Joachim. He's an internist with the Associated Internists of Darien. He's passionate about a topic that's important to all of us, healthy aging.
And especially to me, Joseph, as I get older. Welcome.
Welcome.
It's really good to have you on the show, and I'm really looking forward to seeing what you have to say.
Thank you for having me.
Maybe you can set the tone for our viewers. What do you mean by healthy aging?
Healthy aging is quite simple. It's not as complicated as it sounds. It's about healthy lifestyle. Healthy lifestyle, healthy choices leads to healthy aging. And as we age, it's not only about medical health. It's more about physical health, mental health, social health, financial health, and it's about functionality ultimately. The more functional we are, the more likely we are to enjoy life. The more we enjoy life, evidence have shown that we're able to live longer and better.
It's really interesting because as I've gotten older, the idea of maintaining my ability to do things that I love to ski, I love to hike, and as many of you know, I was injured, had a disc injury a couple of months ago, and I was terribly disabled for a period of a couple of weeks, and it was terrifying. It was a real. I was afraid I'd never be able to do those things again. So maybe you could say a little bit about activity and how important that is as someone ages.
Yeah, I cannot say enough good things about activity. There's no ceiling. The more we're able to tolerate, the better. The more activity we do, the better outcome. The more, evidence have shown that with more physical activities, our life expectancy is longer, and we're able to enjoy life longer. So as I said, there's no maximum amount of physical activity required. However, there's a minimum. It's recommended that for us to, the minimum amount of physical activity is required if you are doing moderate intensity exercise. Moderate intensity is things we can incorporate in our daily life, like brisk walking, working around the house, working a little bit in the garden, dancing. All of this is moderate intensity exercise. And for
using stairs rather than elevators.
Yes, exactly. We can incorporate. It's easy to incorporate, and the minimum requirement for that is 150 minutes per week. And if we think about it, it's not too much time. It's 30 minutes per day for 5 days a week, so it can be doable. Or if you want to do vigorous intensity exercise like competitive sports, running, intensive swimming, we need 75 minutes of that. But if we are going to change our workout routine from moderate intensity to vigorous intensity, I would recommend that we talk to our doctor just to make sure that we are safe to do that. It's also very important to keep in mind, in addition to these two types of exercise, we need to work out all the different muscles, because as we age, our body composition change. We are automatically losing muscle mass. So we need 150 minute of moderate intensity exercise, plus we need to exercise different muscle groups. Core muscles, upper extremities, lower extremities. And again, this is 20 to 30 minutes a day. We can do them at home. You can do sit-ups, modified push-ups, any sort of activities to make sure that you're exercising all the muscle groups.
What do you tell folks who have joint pain and say, well, it's hard for me to exercise because I have osteoarthritis of the knee? What kinds of input do you give to them?
So first of all, we need to look at how much it's debilitating. Is it something very debilitating that the patient cannot use that joint? But in most cases, before we get to that point, there's something we can do. Honestly, it's use it or lose it. The more we are active, the better, the stronger the muscle. The stronger the muscles, the more we're able to support the joint.
My understanding is even if you were having joint pain, one of the treatments for that joint pain is to strengthen the muscles around that joint.
Exactly. The same thing would happen when you had the back pain. If you remained inactive, probably the pain will have lingered for a longer time.
Yeah.
So we need to be active. Even if we're having a little pain, we need to be active.
I think that's so important for people to hear, because we don't want people to get caught in the cycle of pain, inactivity,
Right.
more pain,
I think
more
that's a really
inactivity.
important point, Andrea. The other point I'd like to make is that I think people associate activity largely with cardiovascular health, and it has a much broader effect than that.
I'm sure.
It has an effect on depression.
Yes.
It has effect on dementia.
Yes.
In fact, it probably is, my understanding, maybe you can expand on this, but my understanding is that the one thing we know we can do to help diminish the risk of dementia is to exercise.
Yes. Like also like exercise, if you think about it, if we're ever going to find the fountain of youth, it's going to be through exercise, honestly, because it helps everything. As you said, it changes all the hormones in the brain, so we know that it affects the psyche. And we have studies that show people that are more active in general are less likely to become demented compared to the same people with the exact same risk, and the only difference is exercise. So we have evidence that shows, yes, physical
And one
activity.
thing we haven't mentioned is bone health. And so for women who are at risk for osteoporosis,
yes.
bone health is very important,
Particularly
obviously. and
weight-bearing
can
exercise,
help
you
a
know.
lot.
Yes, that's why in addition to the exercise that we need to get our heart pumping, we need exercises to strengthen the muscle, to build up the muscles.
Now, oftentimes in medicine, when we think about exercise, we also think about nutrition. Can you talk a little bit about nutrition and healthy aging?
Exactly. So as I said, healthy aging is about healthy lifestyle. So physical activity. The second thing is nutrition. As I mentioned earlier, as we get older, our body composition changes. So we are losing muscle and we are gaining fat mass.
That process starts fairly early, doesn't it?
Yes.
It starts in your 30s,
Yes.
and not when you're 70.
Yes, exactly. So the sooner we start exercise, we change our lifestyle, the better we're going to age. And even like let's say when you're 70, we use BMI, body mass index, to quantify. Like it's our weight over our length. So it's a unit we use to see like how's our body habitus. At 70,
how fat we are.
Yes, exactly. That's good. So when we're younger, the limit is between, let's say, 18.5 till 25. That's the normal. That's the target. And then 25 to 30 is overweight, and then above 30 is obesity. When we turn 70, because our body composition change, so studies have shown that the best place you want to be BMI is between 25 and 30. So a little bit. The BMI is a bit higher because your body composition is a little bit.
Which is very interesting, because I know there's the old saying, you can never be too something or too thin. I forgot the. As you get older, in fact, we know that mortality goes up when you are too thin.
Yes.
So as you said, there is an ideal there somewhere that looks healthy. You don't want to be skinny. You don't want to be fat.
Exactly. We want to be in that good group, where even if you had a fall, the risk of having a bone fracture, if you're in that group, is less compared to other. And then it's not about calories we eat, it's about what we're eating. You know, like the best thing you can do is try to avoid processed food and stick with fresh food, green vegetables. Start with the ingredients. You cook your own meal. So
how about supplements? Even everybody's trying to sell you supplements for brain health, for heart health, it's a big industry out there. It's easier to take a pill than to prepare your meals or exercise. I know how I feel about how, as an expert, how do you feel about that?
There's no real evidence behind most of these supplements. So if you're going to start a supplement, I would recommend for you to communicate with your physician, because there might be something you can do instead of using all these processed chemical ingredients. Maybe you can substitute. If you're able to substitute with something natural, that's definitely more beneficial. But you talked about supplements. I want to talk about some patients. So in the elderly patients, we have almost 50% of the patients we see in our clinics with that are malnourished. So they are not obese, they are malnourished. And we don't take it lightly. When we see someone who's malnourished, we need to see why. Like, is it they're not able to get food? Are they depressed? They don't have appetite? They don't have, like, is it financial problems?
Medications?
They can't drive? Yes, medications. They're not able to drive. So we need to dig deeper when we find someone who's malnourished. And I want to talk about the red flag, unintentional weight loss. So let's say if you
Very
are not
important.
trying, yes, if you are not trying to lose weight, and we happen that we lost, let's say, more than 10% of our body weight unintentionally, so we need to like this is a red flag. It might be something bad. It might be, let's say you had heart failure. It's getting worse, or it might be indication that there might be a cancer going on. So
or a
you know
thyroid
what I've
condition.
seen, and maybe
yes,
you could
thyroid, exactly.
comment on this, but I think oftentimes it's something simple.
Yes.
In older people, we lose our sense of smell.
Yes.
Food doesn't taste as good, and even something as simple as access to food. Elderly people, the trouble of cooking becomes too troublesome, or depression. Maybe it's a complex of those two, but I think that it's very common for older people to stop eating and not have a fatal disease. They just simply don't have the energy to cook for themselves anymore.
Yeah, I agree. Yes, I agree.
But it does need to be checked out.
Absolutely.
How about other tips for healthy aging? So exercise, eating good food.
So I would talk about alcohol consumption. Okay, so we grow up, we lose some muscle, and then we gain more fat weight in our body. Muscle have more water compared to fat, and a lot of alcohol tolerance depends on how much water we have in our bodies. So if we lost the muscle, we are losing water. So our alcohol tolerance automatically drops down. So that's why the minimum, let's say, the recommended amount of consumption is less when you're older than 65. So when you're older than 65, the recommended amount of alcohol that can be beneficial for cardiovascular, for heart protection. If someone is
Such
not
as
an alcohol,
red wine.
yes, exactly.
Not all.
Such as red wine, yes, not all, especially red wine. So if someone doesn't drink, I would not recommend to start alcohol.
Right.
But if they drink, I would recommend to limit it to not more than one drink or less. And when we say one drink or less, let's say if we're talking about beer, that's 5% alcohol, it's 12 ounces. Red wine, that's the 5 ounces. So it's less than half of a regular glass, wine glass. And if we talk about like hard liquor like whiskey or 40%, that's 1.5 ounces.
We've got probably less than a minute left, but could you say something about the importance of social interaction and maintaining human contacts?
Yeah, that's I cannot insist on how much that's important. Because the more you have social interaction, the more you're enjoying life, the more you are functional, the longer you're going to live. And even if the social interaction was not face-to-face, even if you Skype with your, because nowadays we have all these sorts, extra sorts, so even some studies have shown that even if you Skype, or sorry to use this, like if you do like video communication, that can be really helpful for your psyche, for your activity level, for you to enjoy life. So
important.
Yeah.
Thank you so much for that great information.
And we can all do it.
Absolutely.
Yes,
This is all stuff we have control over.
Simple.
Unbelievably and unfortunately, we've run out of time. We'd like to thank Dr. Joseph Wakim so much for joining us on Health Talk today.
If you have comments and questions for Andrea and me, please email them to healthtalk@wchn.org. Andrea and I would love to hear from you.
Thanks so much for watching.
And remember, keep yourself fit, active, and healthy.